And with rapid changes in events and happenings across the country are now constantly driving the public to seek sources for information to keep abreast of major developments, driving headlines across all platforms, with many unconfirmed and unverified accounts of happenings in the public domain. NTA now links up with our reporters in the field to establish the authenticity of some of these claims. We join Mustafa Yusuf Musa in DAMATURU, Rofia Anima Shao Badmos in Ibadan, Fatima Sanusi Karaye in Kano, and Emmanuel Akila in Gombe. Good afternoon to you all. I'm going to be starting with Mustafa in DAMATURU. What do we have on the investigation into the cause of the reported death in YOBE state? We hear Potiskum is the hardest hit. What is the government's position on this?
Yeah, in the last couple of weeks, there was this reported cases of death in three local government areas of YOBE state, particularly in Potiskum, Nguru, and Gashua. So yesterday we went to Potiskum town. It's a cosmopolitan town in YOBE state. A lot of people, and we went to the graveyard. We went to the town. We met with the director of personnel management of the local government, and we inquired about the situation. He told us that in the 5 graveyards in the town, from 30th April to 3rd of May, they reported about 150 deaths, though not connected with COVID-19. And in Gashua and Guru, is the same story. A lot of deaths, but not connected with COVID-19. Even yesterday, the Commissioner of Information released a statement, and the spokesman of the governor released a statement. And just a while ago, the Commissioner of Health, Dr. Mohammed Loangana, had a press conference with journalists while he briefed them about the situation. He said they are about the situation. They have sent an investigative team to look into the process of the deaths around those areas.
Okay, Mustafa, while investigation is ongoing, what is the position of the government at this time?
Yeah, the government has constituted a committee to immediately look at the remote process of that death, so that at least they will intervene. But they have sent their team to those areas to go and find out.
Okay, I'm going to put you on pause now and go to Fatima in Kano. Fatima, Kano is still in complete lockdown, but then people are having to take their sick to the hospital nonetheless, and not necessarily because of COVID-19. What do you have on claims that doctors in Kano are shying away from hospital, attending to outpatients over the fear of COVID-19?
Well, hello, Hawa. Nice to see you. What is happening in Kano is that doctors are not absconded from their duty post. I spoke with Professor Issa Abubakar of Center for Infectious Diseases at Amina Kano Teaching Hospital a while ago, and he told me that most hospitals in Kano, some workers have contracted this novel coronavirus, and they cannot come to work. They have to isolate themselves to protect their patients. In some hospitals, even those issuing cards have this virus. So it is making it difficult for both health workers and patients. The public relation officer of Malam Amina Kano Teaching Hospital also told me that the situation is affecting, it's only affecting pediatric, it's not affecting pediatric doctors, family medicine doctors, and so on. So when doctors and other workers who are infected isolate themselves, there is a gap because there is no one to do their work for them.
So how do they intend to fill this gap, Fatima? How do they intend to fill this gap?
So what is happening is that hospital, at Amina Teaching Hospital, they gave phone numbers for some doctors for specialty clinics, so that when a patient is in need of seeing a doctor, they will call that number. For example, they gave a number for child and adolescent clinic, adult psychiatry, child health, orthopedic
Okay, that will be all for now, Fatima, while I join Rufia in Ibadan. Rufia, can you confirm if indeed some suspected COVID-19 cases are refusing to be taken to the isolation center in Ibadan?
Good evening, Awa. Yeah, the news about the so-confirmed COVID-19 patients are absconded from the isolation center here in Ibadan is not true. There were actually some people that were tested, and before the results came out, 2 out of these people disappeared. They were not able to get to isolation. And of course, after intensive contact tracing, one of them has been found and admitted to the infectious disease control.
Okay, Rafia. I will just join Emmanuel.
Witness is clear for the vehicle. Presently, we have 52 confirmed cases of COVID-19 in Oyo State. 16 are active recovered cases, while 34 are active cases. As we speak, too, the isolation center in Ododo is up and running. There are 18 patients there, and there are also plans of establishing isolation center.
Rafia, thank you very much for the update there, but I'm just going to join Emmanuel Akila now in Gombe. Emmanuel, what is the latest on the treatment of COVID-19 patients in Gombe? How have things changed since the return to the treatment center? That's after the protest.
Hello? Yeah,
Emmanuel, if you can hear me, I just asked what the latest is on the treatment of COVID-19 patients in Gombe after the return to the treatment center. That's after the protest.
Thank you very much, Awa, and thank you for joining us in Gombe. Actually, what happened yesterday in Gombe State, particularly in the metropolis, has been described as an absurd situation by a lot of people, because patients who are supposed to be in isolation came out for testing on some issues that they regard as welfare, and as at the moment, the task force committee on COVID-19 in the state has rallied round support and ensured that all of them that came out for protest yesterday in some of the centers have been returned to the isolation center. And during the state task force briefing today, the task force committee assured that they have contained the situation, and all the patients that have been returned are being taken care of, and some of the demands that they raised during the protest have been attended to. And one important thing that you need to know, Hawa, is that Gombe State has a sharp rise in the number of confirmed cases, which is standing at 103 at the moment. But the good news is that since the confirmation of the 5 index cases in April 21st, none of the confirmed cases is showing symptoms of COVID-19. So during the briefing yesterday, the State Task Force on COVID-19 said some of them have been tested, and they will continue to be tested and tested again, so that when they are found negative, finally be discharged. Meanwhile, the state government has set up isolation centers, over 300 bed spaces, and a treatment center with ventilators.
Emmanuel, thank you very much. Emmanuel, thank you very much for the update. We are glad that things are getting back to normal in Gombe. And guys, thank you very much for joining us.
DAE, NTA News.
As schools remain shut, occasioned by the coronavirus pandemic, educational online programs for students and pupils have been ongoing.